Here we are, we're live. All right, let's see. Anna Marie from Quebec says it's minus 12 plus wind chill, and that's minus 12 C. It is warmer than I thought here at my house. It is a balmy 30 degrees. 30 degrees in Washington. Okay, folks, so just let us know where you're from, what the temperature is, and actually, if any of you are currently rehabbing a horse right now, just put that in the chat so I know to kind of come back to you and see if you have any questions. So if you're currently, I'll put that in, you currently rehabbing a horse from an injury. It's 35 in North Carolina. It's a big cold. Give everybody a minute. Let's see, 17 degrees in Northwest. Oh, hi, Michelle. Currently rehabbing her horse. Okay, Barbara in Washington, 57 degrees in Sacramento. Just finishing rehabbing. Wish the seminar was earlier. Okay, New Jersey, rehabbing from a torn tendon. So yes, the answer is yes, people are rehabbing their horses. So, yep. I should ask if anybody's rehabbing themselves, but that's a whole nother topic. Okay. All right. I'll give everybody another minute and then we will get rolling. So if you have any questions, just put them in the chat. I check that easier than the Q&A. I can check the Q&A. It's just another button. And I will keep an eye on it. All righty. Maureen, are you ready? Great. Oh, so he's 15-year-old warm buzz surgery in Guelph last September. We are at the WUC 4, 40 minutes a day, no turnout. We'll double check back with the vet before trot. Frederick, Maryland. Judy Coyne. Oh, hi, Judy. Wow, long time no see.
Hi, Judy.
Wow. It's always fun to see who pops in on these things. All right, it's time to get rolling. Hi, everybody. I'm Wendy Murdoch, and this is Webinars with Wendy. I have been doing this series of webinars now for almost four years. I started in 2020. It's hard to believe. You can find all of them on the wendymurdoch.com/webinars link. And we still have some up on there on YouTube, and Dr. Kelleher's previous webinars, 2 of which are either on YouTube or also in my wendymurdoch.com link. I'll put that in the chat. Tonight, we have Dr. Maureen Kelleher. I am so thrilled to have her back. We had a little GabFest meeting not too long ago, and I was like, would you come back for another webinar? And she kindly said yes. So welcome, Maureen. Thank you so much for joining me tonight.
Thank you, Wendy. I'm super happy to be here.
So Maureen, just for those people who may not know you, can you just give us a brief bio?
Yeah, sure. So I am a board certified equine surgeon and equine sports medicine and rehabilitation veterinarian, and I currently am a faculty member at Ohio State University in Columbus, Ohio. I am a graduate, however, of UC Davis in Northern California, and I practiced spur horse medicine for many years in private practice in Southern California. So I come from a bit of a private practice background, but have worked in academia for probably the past 6 or 7 years now.
Yeah. And we are going to be talking about bringing a horse back. So a horse that's had an injury tonight, right?
Yeah.
So you are the perfect person to talk to about this, given your background. And are you currently, like, I know you're in Ohio State now. Are you doing research on rehab, or what kind of is happening there?
Yeah, so right now I am finishing up some research projects that actually are more to do with injury detection rather than rehabilitation. But moving forward, after I get those projects wrapped up, my goal is to start to do some more rehabilitation-based projects. So there's I think I don't know if it's a resurgence or a surgence, in equine medicine for injury rehabilitation, actually probably even more than that, injury prevention, which I think we've lacked for many, many years. And I'm super excited to see all of the recent research out there available that is, highlighting some of these methods and plans that we can put into place to bring horses back as good as we can. And in addition to that, maybe preventing them from happening in the first place.
Yeah. I mean, it's easier to keep it healthy than to try and bring it back from an injury, whether it's a horse or a person. So
absolutely.
Although there's a lot of lessons to be learned in rehabbing oneself.
Certainly can anthropomorphize with your horse after you've done it yourself.
Yeah. Yeah. All right, well, let's just dive right into your topic.
Yeah, so I think a couple of things, and I'm happy to take any questions that get popped up on your chat. But a couple of things I'd like to just start with are what's involved in injury rehabilitation and what kinds of injuries do horses get that we need to rehab them from. And certainly in horses, we tend to see, we think of probably everybody, first thought is tendon and ligament injury. So my horse has a suspensory ligament injury. My horse has a deep digital flexor tendon injury. My horse has whatever type of ligament injury. However, one thing that I think we've sort of, I don't know if ignored, because we all think about their joints, but they certainly can have some pretty significant injuries to their joints, which happen before we see the onset of osteoarthritis. So I know many people probably say, oh, I have my horse's hocks injected, or I have my horse's coffin joints injected every 6 months or every year or whatever. Most of the time, that arthritis started from some sort of injury, whether it was a mild degree of repetitive injury or an acute overload strain on that joint that led to that arthritis forming. So certainly detecting some of these joint injuries earlier and then treating those joints for that injury before the osteoarthritis sets in is probably going to add to the long-term success of the horse. So we definitely can pay attention to some joint injuries, and we definitely can pay attention to some soft tissue injuries. Now, the thing is that rehabbing from those injuries or bringing horse back from either joint injuries or soft tissue injuries is a little bit the same and a little bit different. And certainly, depending on the degree of the injury, we can bring a horse back from a joint injury maybe a bit faster than we can from a tendon or ligament injury, but certainly some of the same principles apply. So not overdoing it in that rehab period, treating it with either some sort of medication or other physical therapy treatments. And then same goes for the soft tissue injuries, but certainly we're going to be looking at a longer course before we add in some strain and intensity for those injuries. So I am going to share just one slide with you guys. Oops, maybe. And I'm just going to keep this up so that everybody sort of can see a couple of things, some of the goals that we're aiming for when we rehab either a joint or soft tissue injury. And really, we can extend this to injury to nerves, muscles, fascia, the spinal cord, etc. So certainly once the injury's been identified, we need to figure out what level of exercise and what level of control of that exercise we need to have. We need to maintain the horse's proprioception. So basically, they need to be able to know where their limbs are in space, be able to pick up their limbs and place them properly. We need for their top line and their abs to stay strong and engaged through this whole process. And then we need to make sure that those tendons, ligaments, joints, whatever tissue we're rehabbing maintains its normal function. So if we want to just talk about, in general, briefly, we can talk about soft tissue injuries. And so again, as I mentioned, suspensory ligament, deep digital flexor tendon, pretty common. In those cases, controlled exercise is going to be very important. I heard you at the start of the webinar mention something about somebody walking their horse at the 40-minute level. And my hope is that maybe they're doing that exercise, but they're not hand walking, that they're actually doing 40 minutes of walking under saddle. So one thing I am a big proponent of is the horse still feeling like they have a job and the rider still feeling like they are engaged in the process. Mm-hmm. And there's a whole lot more that you can do under saddle than you can do just walking around in hand. Now, not to say that you can't do a lot of this stuff in hand. So certainly you can do proprioceptive exercises and some core and stability training under saddle. And you can, certainly get some of this stuff accomplished, but it may be a little bit at the cost of your mental health and your horse's mental health. So, and there aren't too many, actually, there are no riders out there that I can think of that should not be able to walk their horse for about 99% of the soft tissues. Now, if your horse has a completely severed, ruptured, very, very severe, life-threatening soft tissue injury, then you're probably not going to be walking that horse under saddle for quite some time. However, even with a moderate injury, at some level within your first few months, I do like, again, to get people up in the saddle. I think it's beneficial mentally for both participants. And again, I think you can get a lot more accomplished and everybody, I think, has a little bit better outcomes. Now, most of the time for me, that walking exercise can start anywhere from 2 to 4 weeks after the injury diagnosis. And there's a lot of things that's going to happen while you're doing your controlled exercise and doing some of these other exercises to improve the total outcome. I think regenerative medicine is a huge area of equine medicine these days that gives us all kinds of options. Certainly, that's an area that needs a lot of research as well. There's a lot out there, but certainly the more we know, the better we can pinpoint which regenerative therapies are better for what type of injuries. But I do think for most joint and soft tissue injuries, some sort of regenerative medicine is very beneficial. And those are done, I usually end up doing a series, so anywhere from 1 to 3 sort of treatments with regenerative medicine. Shockwave is something that I like to employ, again, for joint and soft tissue injuries. And again, those usually are in a series of 1 to 3 treatments. And there's lots of other things out there that you can do from a physical therapy standpoint. But I think the biggest thing is time and patience are probably the biggest ones. But I can certainly take a little breather here and see if there's any questions that have come up just based on what I've mentioned already. Or you
have one actually. What is the current thought about stall rest? So say the vet comes out and diagnosed my horse with a tendon injury. I've heard pros and cons about stall rest. So what's your perspective on that?
Yeah, so that so stall rest is a little bit of a tricky one for me, because I will tell you that I think there are 2 versions of what stall rest is. There's stall rest that an owner interprets, and there is stall rest that a veterinarian or a veterinary student interprets. And if somebody says your horse needs to be on stall rest, I probably would say, okay, that means he's got to live in his stall, except for when I'm allowed to take him out to do his exercise, and he can't be out of the stall anytime other than that. And that's where I try to not use stall rest, but use controlled exercise. So not to say your horse can't go outside or can't have some sort of access to grass or get some sunshine on his back. But the amount of control that you have over his physical body is what matters. And if I've got a horse with a pretty a moderate injury to a soft tissue, I'm not going to put him out in a big, huge pasture and let him decide to go cavorting about with his mates and cause more damage to that. However, if he likes hanging out in a sun pen or a small paddock and he doesn't do anything other than walk around and you've got pretty good control over that situation and he's pretty quiet, then I'd rather that horse not feel all cooped up in a stall. The other thing is a lot of people will say, if I put my horse in a stall, they're going to go crazy and they're going to pace and they're going to weave. Certainly there's lots of thoroughbreds out there that are the great animals, but if you put them in a stall, they're going to weave or they're going to pace or they're going to circle or they're going to get themselves worked up into a panic. And certainly that's not going to allow any injury to heal. Mm-hmm. So my rule of thumb is put them in the smallest space that you can, that they are going to be the quietest in. And for some horses, that's going to be a pasture. Does that reduce your chances of getting the end product that you want or need? It does, but it may be a better end product than putting that horse in a stall and having them panic. Now, on top of that is, well, some people will say, okay, well, what about, can I give them trazodone, acepromazine, reserpine, etc. So some sort of sedative or behavior modification medication. And I do think that is a very good option. Again, there are chances that that medication will either fail or maybe the horse will have some other quality of life issue on that medication. And so again, it becomes a balance of what you're willing to accept versus what you're willing to give up. So I do think medication can be important, but I also think that mental health is also important for the horse and you, honestly, because if you're stressed about the horse hurting himself because he's pacing around the stall, then your mental health is not good either.
It's such a delicate balance, isn't it? Such an individual horse by horse thing, isn't it?
Yes, absolutely. Absolutely. Yeah.
Someone's asking if you can define regenerative medicine.
Yeah, sure. So these days we have lots of options for what is termed as regenerative medicine or orthobiologics or biologic agents. And I sort of lump them, they all get sort of lumped together. And basically they consist of some sort of, usually a blood product, bone marrow product, fat product, something from your horse's body or another horse's body that concentrates cells that are used for healing. So some examples of products would be platelet-rich plasma or stem cells or adipose, like an adipose, a fat-derived product. And so what we take the good stuff out of those, so healing factors, growth factors, anti-inflammatory proteins, etc., and we inject that back into the horse. So there's usually some processing that happens, either centrifuge or culturing or something along that line. And then we inject it either back into the joint, back into the tendon in the area of the injury, or around the tendon and ligament, to just sort of bathe the area with those good resources that are of the horse's own production.
And I mean, I'm sure there's a ton of research behind these regenerative processes. I just remember when I had to go back to my orthopedic, he was like, that was all hooey.
Yeah, there's much more research out there these days. And actually, the horse is a very good model for human athletic injuries. So actually, the equine medicine has sort of led the way from being sort of the first species to sort of be used athletically, and now it's really commonplace for human athletes to be getting platelet-rich plasma. Certainly stem cells, I think, are off the table still for most human athletes, but they're not off table for equine athletes for sure.
Okay, great. Okay, let's go. Let's keep going.
Okay, so let's talk a little bit about these core stability exercises. And I'll bring this in mostly because the SureFoot pads will be nearly essential for some of this. And so one thing that happens when horses are not in work, when any of us are not in regular exercise, is our muscles become atrophied, become weakened. And certainly that applies not just to the athletic muscles, but also the muscles of our of the horse's top line and abdominals. So these are stability muscles. They help us stand properly. And if those become weakened, then we are going to lose control over our body. And so if a horse is being rehabbed or recovering from an injury to a tendon, it's unfortunate that if we didn't maintain some of these core stability muscles, it's harder to bring them back from that injury, because not only do we have to let that injury heal, but then in the process of bringing them back to work, we're going to have to start from square one and rebuilding rebuilding their top line, rebuilding their core, their abdominal muscles. And so in the horse, some of the more important postural stability muscles are all along the spine, and those are going to be the first ones to probably get tossed out the door if a horse, for example, is just standing in a stall all day. And so if the horse has an injury where they're not getting out and doing a lot of exercise, maybe it is bad enough that they're only getting out for a walk for about 10 minutes a day or 10 minutes twice a day, and then the rest of the time they're just standing in their stall, then certainly those muscles are going to atrophy. And so there's lots of things that we can do to kind of keep those muscles engaged, and those can range from doing some things like carrot stretches or butt tucks or tail pulls. They can also be in the form of when we are doing some exercise, doing some resistance bands training. But stability footing is certainly going to be very useful for really, honestly, the biggest thing is probably for those stabilizers of the spine. So standing on the SureFoot pads for a period of time each day is going to help maintain that horse's posture from not only just its top line, but also help with its abdominal engagement.
And have they done any studies? I don't think they have, but I'm going to ask, have they done any studies with how long the horse has to stand on a stability pad to see an improvement in muscle tone or a maintenance of muscle tone?
Not that I'm aware of. I will say that there was a recent publication of the horse regarding, I think the horses stood on the pads on all four for 20 or 30 minutes a day for a month, and they definitely had a significant improvement in their postural stability. So they were able to balance themselves better at the end of the month than the beginning of the month. It wasn't measurable from if we were to measure the muscle diameter in the back over that 4-week period. We didn't see a huge significant change in the diameter of the muscle, but these also were horses that were going into this not with an injury. They were just research horses, so they probably didn't have good postural stability. So they did see a significant effect of that. But you know, it probably was too short for us to see a growth in muscle just yet.
Okay. But they did see an improvement in posture, which indicates that something's going on.
Yes, absolutely. Yes. And certainly, like I said, if our top line and our back stabilizers are not weakened while we are on controlled exercise, then it's going to be easier for that horse to return to its previous level of activity in a shorter period of time without as much struggles, is if we let them just kind of hang out for a period of time, letting their tendon heal or letting their joint heal and letting all of those back stabilizers or spine stabilizers weaken. And then now we've got two things to overcome. Our spine is not stable, and we've got to get our tendon back to where it was before pre-injury.
Yeah. And so, I mean, I know they've done studies looking at enzymes in horse muscles, as I understand it, like from a conditioning perspective, that a horse's enzymes stay in the system longer, like a person starts deconditioning almost immediately, whereas a horse, excuse me, maintains those enzymes for longer. Is that right?
Well, they will start to, so horses are pretty good at breaking.
Sorry, hang on. That was a pilot error on my part. I meant to turn my mic off so I could cough, and I think I turned your mic off.
Yep, there you go. Okay, good. And I'll just throw this back up there. Okay. So the horse is actually pretty good at, so they can atrophy their muscle, or the muscle can become weaker without a lot of leakage of enzymes. So most of the time, the muscle enzymes are going to become elevated when the muscle actually is completely damaged and the muscle cell is ruptured. So they can actually start to atrophy very quickly. And this, I think, is best evidenced in horses that have neurologic disease. So horses that have EPM, equine protozoal myeloencephalitis, or an injury to a muscle injury to one side of their body, or a very good example is a horse with a pelvic fracture. They will, with not using that muscle, you will start to see atrophy occur quite quickly. I think because the horse tends to is such a muscular animal, I think that we don't recognize it unless it's very sudden and very severe, but it does happen pretty quickly. It's gonna, as soon as the horse stops exercising, they're gonna start to lose condition. Oops. Okay, so you're muted.
There. Okay, now my mic's back on, right?
Yes.
Now you can screen share again. Nothing like trying to cough and then not wanting to. What was I saying? So it's important to actually start with as quickly as possible with something to keep the muscles active while obviously not doing further damage to the injury.
Yeah, and one good way would be some of these passive range of motion exercises. And I really like these, especially for some of the joint injuries. So if you have a horse that has a fetlock joint injury, certainly doing some passive range of motion is going to keep that joint moving. But you're also going to be activating the whole limb. The horse has to pick it up, you have to flex and extend it. And so certainly, especially with some of the upper limb, we can get some range of motion going, and that's going to help maintain some of that muscle mass. And then, there are different, I mentioned the sort of the postural stability muscles. Those are going to be different than our working muscles. And so certainly that's where this walking comes in. Walking is very important to keep some of those limb muscles, the non-postural stability muscles, from atrophying. It may not be a very heavy or extensive or intensive level of exercise, but the horse is moving around and using those muscles without creating too much trauma to whatever structure is injured. Now, again, there's lots of examples of very severe cases, and I'll just throw another one out there, which is laminitis. Now, here is a situation where laminitis can be, again, life-threatening, and even in a mild case of laminitis, we don't want those horses moving around on their feet too much, but we need them to put a little bit of weight on those feet because that's going to be pumping blood through the hoof. So I want that horse to be comfortable enough to move a little bit, but not too much. In a severe case, certainly making those feet as comfortable as possible to allow them to stand on them, and in order to get some blood flow through those structures is really important. So passive range of motion, the stability, footing, again, is going to help with that. If you've got a laminitic horse that can't really be walking around, but if you put him on some SureFoot pads and the horse can rock back and forth a little bit, then he's at least pumping a little bit of blood through that foot, and that's certainly going to be less traumatic than that horse walking around a bunch, but it's going to be helpful for that foot.
Yeah, but, I actually had a horse in the barn that had laminitis, a winter laminitis, actually. It was quite a few years ago now, and putting her on firm slants, and she would stand there, and she wasn't swaying really, but she would stand there for about an hour very comfortably and quietly, and the owner just sat with her, and she went from pointing and being incredibly uncomfortable to being much more able to stand square, which is going to help her. Obviously, you have to deal with the metabolic problems as well. Yeah.
And another thing I'll say is, that horse probably had a bit of movement that we couldn't wasn't very super perceptible to the owner. But there probably was enough movement that that there was some blood flow getting, increase in blood flow getting to that foot. Well, certainly that's a good research project to try and figure out if we can see a change in that blood flow. But I can tell you, so I am a big injury detection person. I love diagnostic imaging. And for many, many years of my career, I've worked with standing MRI. And you could have there's nothing more frustrating than a horse that looks like it's standing 100% still and getting an MRI that shows that it was not standing 100% still. So if anything taught me that horses can have imperceptible movement, it is looking at MRIs of horses' feet that looked like they were not moving at all. And certainly the imaging never lies.
That is so fascinating, actually, that because you would certainly pick it up there. Yeah. Wow.
So let's see. I think we've talked about almost everything that I sort of put here. I mean, we certainly can talk about all kinds of different modalities, but the three, when I'm teaching veterinary students about tendon and ligament and joint rehabilitation or healing, really, there's three things that have to happen no matter what. So everybody has a budget, and there's only so much you can do with the amount of money that you have. And sometimes you don't have enough in your budget to do the regenerative medicine and all the shock waves and all kinds of things. But the three main things are going to be controlled exercise. That's one thing you always have control over. Number two is cold therapy. And I can go into that a little bit more because my approach to cold therapy has changed a bit over the course of my career. And then number three is compression. And so I think a lot of with these joint and tendon and ligament injuries, some of the newer things that, again, probably in the past, maybe, I mean, we've always been putting standing wraps on them. So it's not like compression is a new thing, but what type of compression we do and how much compression, I think is definitely advanced over time. And so it's, for me, especially when there's any sort of swelling, I think that compression is very important. And so that may start out with quite a bit of compression at the beginning when it first happens, as it's being diagnosed and determine what's going on, and gradually taking away some of that compression. But certainly that's going to help with blood flow, lymphatic flow, etc. Depending on what kind of compression it is, can also incorporate cold and warm therapy. And that's one thing that's, as I mentioned, how I deal with hot and cold is a bit different. I think when I went through school and just was starting out my career, we said put cold on everything. And I think in the early stages of any injury, cold is absolutely important. And we have lots of cold therapy options available to us, but getting the temperature down a couple of degrees in that area of concern is really important in the very acute phase. Now, if somebody says to me, my horse has been lame for 4 months and I can't figure out what's going on, and we determine 4 or 5 months later that it's got a deep digital flexor tendon, at that point, the cold therapy is not going to do anything. At that point, I need to switch tactics. It's not the amount of injury and inflammation. The acute phase is by the wayside. So for me, in that situation, what I need to do is make those tissues, especially those that have started to heal already with some degree of scar tissue, is to make them more elastic. And so in a very acute injury, I absolutely am a proponent of getting some cold on that leg and get that inflammation out of there. Cold is going to take the inflammation down and away. However, once we're past that acute phase, I don't do a lot of cold therapy because that is going to make all of those tissues very inelastic. So warm tissues are much more elastic than cold tissues. And so if I am rehabbing a horse for a tendon and ligament or a joint injury, after the acute phase is over, then I'm going to do warm therapy. Now, I'll back that up a little bit and say, if I've got a horse that has had a joint injury and the acute phase is over, before I go out and do my 10, 20, 30, 40 minutes of walking exercise, I'm going to warm up those tissues as best I can. And there's lots of different ways to do that. But once I come back from riding that horse for whatever length of time that I've just worked him, then I'm probably going to put some cold therapy on before I put him back in a stall and put him away for the day. Because in theory, I've probably gone out and I've created some tension, stress, strain on that structure, and I've probably created a little bit of microinflammation. And so bringing the horse back and putting a little bit of cold therapy on for 20 minutes is probably appropriate. But it's certainly not going to be what I do when I get to the barn and get him ready to go out for his controlled exercise. I'm going to get those tissues as elastic as I can. And I think people think about joints as not being soft tissues, but the entire joint capsule is essentially like a ligament, and it is a soft tissue. And so getting that joint capsule to be as elastic and movable as possible before we go out to do our work is super important. So cold is good in the acute phase, cold is good after exercise, but honestly, getting those tissues warm and ready for work is probably the most important thing. Not only during the bringing the horse back to work, but once you have given the go ahead by your vet to go back to complete work, your horse is healed. That's part of injury prevention, is getting those tissues ready for their job and not just assuming your horse is super horse and can just go out and leap buildings in a single jump. So, and as your horse gets older, that's going to be more important to do. So in a youngster whose tissues are probably naturally a little bit more elastic, maybe it's not so important to start your ride with a 10 or 15 or 20 minute walk. But if you've got now, my horse is now 15 years old and he is a great athlete, but we start almost especially in this really cold weather, we start every ride with a good 15 or 20 minutes of walking, and not just moseying around walking, but like we're working at the walk. But that's going to help his tendons, his ligaments, his whole body become more elastic, and that is going to prevent him from having a soft tissue or joint injury because I haven't prepared him for the work that I'm asking him to do.
Yeah, I think people don't realize the value of that walk for humans and horses, right? In terms of warming things up and getting the system working. And with the human walk is actually the most efficient walk of any animal on the planet because of the rotation. But when you first start out and you're cold, you don't get that. But as the system warms up, you're storing and releasing potential and kinetic energy because of the rotation. And I think it's got to be true in the horse as well, is those tissues have a function that I don't think we really understand well how those tissues work in movement. So we have a couple of good questions here. One is, how can we warm up the tissue before exercise? Walking certainly being one, and maybe you have some other ideas. And the other one is, how do you apply warm therapy? Familiar with cold, but wants to know how to do warm.
Good. So again, unfortunately, with the whole equine world, there's a range from the inexpensive stuff to the super expensive stuff. And so if you're on a budget, one of the best ways that you can warm up tissues is going to be walking and doing passive range of motion exercises. You could also, when you get to the barn, you could put standing wraps on all 4 legs. And while you're grooming the whole rest of the body and picking out feet, you keep those standing wraps on for 20 minutes. And just having them wrapped is going to create some warmth in those tissues. So those are some super easy, quick things that you can do that cost you essentially nothing. Some other things that you can do, again, depending on what you have available to you. So if you've got a horse that maybe has a really cold back and you need to warm up his back, certainly there's all kinds of warming blankets that you can put on, magnetic blankets, ceramic material type blankets that you can put on before you go out and work them. There's PEMF, there's all kinds of post-electromagnetic field therapy, different machine-based or just blanket-based things. But if you don't have that available to you, and if you have a dryer out in the barn, or you're at if your horse is at home and you can throw a bunch of towels in the dryer, you can even get them a little bit wet, and then throw them in the dryer to get hot. And then you can warm. And then you can bring those out and place them over the horse's back. If they're a little damp, then there'll be some more heat movement between the horse and the towels. But certainly like this time of year, I like to warm up my saddle pad before I put it on. So there's lots of, you don't want it to be scalding hot, but if it feels comfortable and nice and cozy for you, then it's probably good to put on your horse's back. So there are some little things that you can do like that don't cost you anything other than maybe having access to a dryer. Or to just be conscientious about wrapping your horse's legs, putting them in some standing wraps or some polos for 20 minutes before you go out and ride them.
Yeah, you could probably even use a hairdryer to warm up your saddle pad before you throw it on your horse's back.
Yeah. That's a good
or
one.
His bit. Okay, so and hand walking. One of the things this brings up is a lot of people just want to put their horse in the round pen to warm them up, but so often I see that the horses are not either moving efficiently or they're moving in ways that might not be great if they're cold.
Yeah. So sorry, the dogs were barking there for a second, so I tuned out for a little bit. But yes, there are ways that, as far as walking exercise, you can be very inefficient at that walk exercise. And that's another reason why I like for the horse to get under saddle sooner rather than later, because again, I think you can ask them to lift up their belly a little bit, round, and do different exercises that are probably a bit more efficient use of their muscles and can create a little bit of warmth just in trying to get them. I have just started doing this one exercise that my older guy loves. And that is, we start out marching along on a loose rein, and then I gradually take some contact, and then he's got to walk along at that same march with the contact. And then when he's done that a bit, then I just gradually let the reins out and let him have his neck again. And it seems to be a really nice, I can even feel his back start to round it. All we've done is march along with a contact and without contact without contact. So hopefully that's what that was the question you were after. I got a little disrupted by some barking dogs.
It's okay. There's a couple questions I've missed earlier on that I'll come back to. Judy, I'll come back to your question because there's a short one. Is laser therapy like Centurion? Will that warm up tissue?
Yes, absolutely.
Okay. And then we did how to apply. What is your experience of collagen elastin joint injections for treatment of early OA and stifling or hock?
Okay. So I'm assuming by that they're talking about some sort of biologic product. Collagen itself comes in lots of different numbers, types. So tendons and ligaments are predominantly type 1, and those are long, straight fibers, but scar tissue is type 3, and that's all like I always sort of make that akin to like if you took a ball of yarn and threw it up in the air and then had to go put it back together, it would never be in a nice, neat form. And then in joints, it's actually type 2 collagen, and that's within the articular cartilage. And so when we put a biologic in, that we're trying to restore some of those lost proteins and structures. And so, for example, hyaluronic acid is a normal joint constituent. We often inject that into a joint, and that's going to aid the articular cartilage in some fashion. And so elastin is a joint protein as well. And so the idea behind some of those products is to give that joint the resources it needs to rebuild itself, to make itself feel better.
Okay. Judy's asking, what are tactile exercises?
On
your slide.
Okay. Yes. And these, I love these, and we do them a bunch without even realizing it. So if your horse, if you put bell boots on your horse when you go out to ride, you are doing some tactile exercise. So basically, it's basically using the sensation of touch to improve upon motion, the limb motion. So if I have, for example, a horse that's a little bit weak in his right hind, I'm going to tell the owner, okay, I want you to put a bell boot on the right hind when you go exercise them, so that the horse will feel that bell boot on that right hind, and they're going to think about that, and they're going to use that limb more. They're going to be a little bit exaggerated on that. And so that's going to help build strength and function in that weaker leg. Now, if your horse wears bell boots 100% of the time, then he's basically nose blind to the bell boots. So these are going to mostly work in horses that aren't wearing something on their legs all the time. It's not something, we all, or maybe not all, many people might be aware of in the gaited horses. They often, you'll see them train with little chains on their pasterns. Those chains are weighted chains so that they learn how to pick up their leg with more energy or more fancy. And then when they go in the show ring, they take those off, and the horse feels their leg feels lighter, and they have more action. So it's kind of the same thing. I don't use a lot of chains, but you could use a very lightweight, smooth chain for sure. That works. Some people use little dog or cat collars around the pasterns, and those work really well as well. But I think everybody usually has bell boots in their barn. So that's probably my first go-to, is to do that. But if you needed to really do more, so say you had, again, let's take a horse with a pelvic fracture, that the fracture heals, but it's got a significant amount of atrophy, you might want to start with a bell boot and then progress to a weighted chain, and then a little bit more of a weighted chain, and make it harder for the horse so that he regains some of that strength.
Yeah, and that's where Also, like the Tellington Touch body wraps are also tactile, are super handy. Yep. And Robin has a whole book of body wraps for horses, different configurations. And I think a lot of it has to do with the fact that it's not strong, but it just brings in that sensation.
Mm-hmm. Yep, exactly. It's like a thunder shirt for a horse.
Yeah. Yep. Someone's asking, can stability pads, exercise bands continue to be used once the horse is back in normal workload and you're focusing on conditioning and strengthening?
Yeah, so absolutely. So I'm very conservative with using the resistance bands in a horse that's not in a good enough shape for them. So if the horse is fit and well conditioned and you want to add some of that resistance band training in, then great. But if this horse has, for example, comes to me because it's got a bad back, I'm certainly not going to have them dive right into resistance bands training, because that's going to make their back more sore. So I actually like the resistance bands more for horses that are very fit, without spinal injury, or without pain. So it would be really good, again, for neurologic horses. It would be very good for horses that maybe have a lower limb injury that you're bringing back to work and you're doing a lot of walking and you don't want to lose your core or your top line, but they don't have an underlying weakness in their core or their top line. So they are fabulous for injury prevention for sure.
And then also the stability pads for horses in normal conditioning.
Yeah, absolutely. Yeah, again, anytime you can, everything comes down to the core, whether it's for us or for the horse, right? If they don't round their back and use their core, then they're going to be susceptible to any type of injury. And so anytime we can improve the postural muscles or those core stabilizers or stabilizers of the back, then we're going to have a healthier, fitter horse doing its job. And so, yes, I think just from an injury rehab and injury prevention standpoint, having them stand on the SureFoot pads is going to make that their postural muscles stronger and more resilience.
And when you're talking about resistance bands, I found that really fascinating, because I haven't heard that really this should be for horses that are fit and working, and I see people wanting to use it for weak horses, and my gut has always told me not to suggest that, but to go more like with the T-Touch wraps, where you're working on the proprioceptive contact feeling, this is where your body is, here's how to organize it, versus I think that the resistance bands, I don't know that people can recognize two things. One, when they've set the strength too high, like too tight, and two, when their horse is fatiguing and they're going to start using compensatory muscles.
Yeah, exactly. And I will say that there's a couple of the two traditional probably placements of those resistance bands are going to be like what looks like a Western cinch, so on the belly behind the girth, and that's probably the nicest one. So if I'm going to start with any of them, that's the one I start with. And in horses that have any sort of spinal injury or spinal pain, I should say mostly pain, that's the one I'm going to concentrate on. And so yes, it's more a bit of akin to a tactile stimulation, saying, hey, don't forget your abs, don't forget your abs, don't forget your abs. The one that concerns me the most about especially horses that may be weaker in the back or the top line is the one that goes around the haunches. And that is can be very, very fatiguing, because you're essentially the resistance band part of it is pushing the horse's hind end underneath it, which, yes, that's what we want. We want them to work from their hind end underneath them. But if they're tired, then they're not going to use their body properly, and they'll hurt themselves, or they will posture inappropriately in their back, and then their back will hurt more.
Yeah.
So,
Monique's asking, in winter, is there a temperature where it's just too cold to work your horse in hand or ridden? What about rain or snow if you don't have access to an indoor space?
Yeah. I think we were kind of touching on that earlier before we went live. I think right now it's been around during the day 12 to 15 Fahrenheit where I am, and the horses are keeping themselves warm by eating, and so I think that's probably the best thing for them. It is a little tough because you think, well, am I losing with him not working? Is my horse losing condition? He probably is losing a little bit of condition. I try to get out there and at least do some, like today I did some groundwork, and that was not very intensive. It was more fun for my horse rather than anything else. And so we did some groundwork, and he had to make small circles and walk around me and stay engaged and do fun things and stop when I stopped and go when I walked. So I'm keeping his brain mentally fit, but maybe not keeping his body quite as fit. But I also don't want to lose anything by injuring his lungs or anything like that by the cold temperatures and working too hard. So I pretty much cut it off at about high 20s for me. I don't know if there's a lot of research behind what's too low to work in, but for me, when we're getting to be 27 Fahrenheit or less, I'm probably going to not do anything too heavy. Maybe that's when I get on and tack walk and do our lengthening and shortening exercises and treating him, to some walk work, but certainly not get his heart rate up too high or get him too worked up where then I've got to take a lot of time to cool him off properly.
Yeah, and it probably also depends on what horses you're used to. The reason I say that is I used to go to Finland to teach, and I was there in the winter. They did heat the indoors, but if it got up to 32, they didn't turn the heaters on. And it could be quite cold. So I think it probably also has to do with what horses and people are used to.
Yeah, absolutely. I mean, we all become adapted to our environment. And so those horses, certainly if you took a horse from Florida and flew it to Finland, you'd be in a world of hurt trying to do anything with that horse. And vice versa. If you took a horse that was adapted to the cold and made him go live in Southwest Texas, he'd probably have a really hard time adapting. So yeah, I agree. And that's the same thing if we think about human athletes that are, human skiers are adapted to working in the cold and at altitude. And that's how they train to be better athletes, as they accustom themselves to those temperatures and those altitudes. And so, and even other athletes that want to gain, they'll work at higher altitudes, maybe not necessarily colder temperatures, but higher altitudes in order to get good benefits for their body as an athlete, but they're not going to do that for a prolonged period of time. It's going to be part of their training.
Yeah. Well, Maureen, this has been an awesome webinar. It's, as always, really fascinating. And just go ahead and unshare your screen. And it's been great questions, really good questions. And I think, my takeaway is heat up my saddle pad before I put it on my horse. It's a really good one. So along with the other things, of course, but that was like, oh yeah, It makes a lot of sense. So thank you so much for joining me, and thank you everybody. And of course, this will get posted up. You can go to wendymurdoch.com/webinars, and you can find all of the latest webinars there. So thank you so much, and we'll see you next time. Thanks, Maureen.
Thanks, Wendy.
Bye.
Thanks, everybody. Bye.